In this lecture, we're going to be talking about the obsessive compulsive disorder and some coping mechanisms that you can follow based on rational emotive behavior therapy. So how can we deal with OCD through REBT? First, there are four main ideas that we are going to discuss: affirm, focus, change, and adapt. When there is a recurrent obsessive or compulsive behavior, try to consciously affirm its execution. Whether it's locking the door or washing your hands, whatever it is. The reason why it's compulsive, it's because it is being reinforced by subconscious influence. So you need to dominate your state of mind by using conscious interpretations of the situation by affirming that you already did what you're feeling compulsive into doing. Being conscious that you already washed your hands, being conscious that you already locked the door, being conscious when you're locking the door, and being conscious when you're washing your hands, and reinforcing that through affirmations. And make sure that you focus, because OCD behavior generally starts occurring, as we said, on a subconscious level. And when you focus on forcing your consciousness into the process, and you focus on making sure that your consciousness is dominant over your subconscious level, you will start moving into a more conscious, rational interpretation of the situation. Moreover, use the change method. Control your compulsion and obsessiveness by distracting yourself from thinking irrationally. If the rational approach is being blocked, if you cannot rationally adapt to the fact and consciously adapt to the fact that you already did what you have to do, then try to distract yourself as much as possible. And when you feel more focused, then you will work on reinforcing rationality on a conscious level. And lastly, you need to adapt. Adapt to different environments where your disorder would not manifest as severely as it does. If you have an OCD related to seeing everything in order, and you're sitting on your desk and everything is not in order, you're not helping yourself with the environment. You need to understand what kind of environments are you adapted to and adjust yourself rationally according to that. It will be irrational to think that you can overcome your obsessive compulsive disorder when everything around you is in disorder. But when everything is in order, then you can rationally realize that everything is in order, and you can stop this obsessiveness and this compulsion about thinking everything needs to be organized and needs to be straight, because it already is.